Hi, my name is Bart Valdez, and I'm the CEO of U.S. Nursing and Fastaff Travel Nursing. With the outbreak of coronavirus cases reaching nearly 2 million globally, our entire world has been turned upside down. Though there's very positive reports from New York and Washington State, the two initial epicenters of coronavirus, the virus is still spreading into those locations such as the Southeast and the Midwest, which is shaking the collective faith of the nation. Our business is in the unique position of having insight into emerging hotspots based on increased nurse order volume from around the country. For example, in the last week of February, we saw our orders spike in New York, Washington State, and California, which became the initial epicenters of coronavirus. What we then saw at the beginning of March was order volume increasing in Massachusetts, Illinois, and Louisiana, which are now our current hotspots for the virus. This past week, we started seeing significant numbers of orders from New Jersey and Connecticut. So we continue to see the rapid spread of this virus around our nation. The thing I think about more than anything are the people behind the numbers. I remain in awe of and draw inspiration from the healthcare professionals that Fastaff employs and that are defending us at the front lines of this battle every single day. When our first coronavirus order came in on February 28th, it took mere hours to identify and secure the experienced nurses who were eager to help and courageously packed their bags, left their homes, left their loved ones, and were on site at the acute care hospital within 48 hours. They replaced nurses in Northern California who had to be quarantined due to suspected exposure. These travelers had no hesitation and no fear. When it all started, the contagion was the most frightening part of COVID-19. Then, after a week of hospital census spiking at exponential levels, it became a shortage of personal protective equipment that threatened to topple the efforts and endanger healthcare providers. And more recently, we have all learned more than we ever wanted to know about ventilators and the N95 mask. But mostly, we've learned that there just aren't enough of them. But yet, the nurses continue to run right into the fire of COVID-19. Recently, one of our nurse leaders was exposed to COVID-19 at a New York-based hospital. She was required to quarantine for 2 weeks. Thankfully, she's feeling fine and she's much better. However, this week she was released from quarantine and is already back at the front lines taking care of COVID-19 patients. When asked about going back to the nation's hotbed of coronavirus activity, she simply said, "It's my duty, it's my job, I'm a nurse." It's impossible to not be inspired by these healthcare professionals, not only the doctors and nurses, but the hospital maintenance crews, the ambulance drivers, the food preparation teams, and all of the support crews who face the day not knowing what to expect, but fearlessly bringing their best to bear. On behalf of my team at Fastaff, I want to say thank you. Thank you for everything that you're doing, for keeping us safe and fighting this terrible, terrible virus.